Welcome. Hi, everyone. It's another weekly webinar, Thursday, May 29th. And I was already happy to be here. I love the pre-show chat, but I'm always happy when I see that our speaker has joined us. Thank you, Dr. Morad. Give me 1 second to do our usual housekeeping notes, and then I will introduce you. Dr. Morad is ready with the slides. I love it. Okay, so today's weekly webinar, as always, please, unless you are Dr. Morad, please mute yourself. So that we won't have any background noise. Feel free to use the closed captioning feature if you need that support. Questions, comments in the chat for Dr. Morad, and I will certainly watch the chat and we'll have time for questions. Let me introduce you to our speaker. I met Dr. Morad a couple months ago at one of my favorite things that I get to do at KU every other Monday at 8:30. So think about me at Monday mornings at 8:30. We have a gathering of anybody who wants to come in the KU Medical Center community. We do a check-in about what's going on. How was your week? How was your month? It is not a faith-based organization, but we call it a spiritual gathering. And it's open to anybody of any sort of belief, including no belief at all. And we just get together and we talk about what's going on and we give each other support and we learn from each other. And Dr. Morad was one of the guest presenters. I think it was in April, maybe. And he told us about his life experience, and it was so beautiful. And I thought, self, Dr. Morad would be a great weekly webinar speaker. And I emailed him and he answered right away, yes, I will do it. And so I'm super grateful for Dr. Morad coming to share his expertise. He is a cardiologist at KU Medical Center and an assistant professor and an all around great person. So I'm going to turn it over to you, Dr. Morad, and we are excited to hear what you have to say about heart health and brain health. Thank you.
Well, thank you very much. Let me just confirm. Can you hear me well?
I can hear you and I can see your slides.
Perfect,
So perfect.
perfect,
Yes,
perfect. Excellent. No technical difficulties. That's
none.
wonderful.
Yes.
Well, I'm really grateful for this opportunity. I'm really happy. Whenever you tell me to talk about the heart, that's what I do day and night. So I'd love to be here, and I'd love to share some of the insights of what we do for cardiovascular health. So I run something in KU. We call it the Cardiovascular Prevention Clinic. So we try to deal with heart issues before they arise. Like at that time, you were talking about spiritual, right? We talked at the heart as a spiritual level. Now we're going to talk about more the technical, about how to keep it healthy, right? And they interact really well together. So I'll talk to you briefly about cardiovascular prevention. I'll use some technical terms, but I'm going to try to be as I'll make it as easy as possible to understand. So I'm going to be using analogies, and I love using analogies. They're not going to be perfect, so don't basically just take them exactly the same, but they're going to make stuff much easier to understand. So when I talk about heart disease, mainly here, there are multiple levels of heart disease. The heart is a pump. I think of it as the CEO of the body. I know everybody talks about the brain, everybody talks about the kidneys. They're all amazing organs, right? But the heart is in the core of it all. And it is the pump that pushes blood to the brain, to the arms, to the legs. Blood is important because it carries oxygen. So the way I think about it is you bring oxygen in through your lungs, right? And that's like the central bank. Oxygen acts like currency, like money, because nothing will work. Like we can volunteer, but to survive, actually, you need to work, you need to make money. So the heart will take all this money and is going to send it to the brain, is going to send it to the legs, going to send it to the kidneys, and is going to be paying every single organ. The brain sees the oxygen, it can create energy, it can work very well. So the heart pays everyone. So I call him the CEO, and it has pipes that run on top of it itself, right? So the CEO has to be paid itself. And that all of this happens through what we call the cardiovascular system. So these vessels just extend throughout from the heart all the way to the brain, arms, legs, to the intestines, and then they come back, bring in all the deoxygenated, the poor blood back so it can get filled again. So that's the principle. So when we talk about heart disease, we might be talking about the heart muscle problem. That's what we call heart failure. It has two types. The heart cannot push well or cannot bring the blood well back, cannot suck the blood back. So that's two types of heart failure. It's very common. When we talk about heart problems, remember it's electricity, right? There's top chambers and bottom chambers, and it beats. Thank God we don't have to think about pushing our heart to move 60 times a minute. When I go upstairs, I have to increase it to 90 times. So our heart tries to do that on its own, which is wonderful, right? So there is a problem sometimes that arises in the electrical system. So we talk, that's why you will see electricians of the heart. That sometimes the valves inside the heart that the blood has to move forward, not go backward. There are doors inside the heart. And those doors basically open to let the blood in, and then they have to close to prevent the blood from going back. So these are the main issues with the heart we talk about. And that's not mainly what I'm talking to you about today. We'll talk about the most important disease of the heart, which is called heart attack or atherosclerotic disease. And that's when the blood leaves the heart. Remember, we talked about blood coming back to the heart through the pipes of the heart. And I'll show you here an example. Here's a CAT scan that shows us here's the muscle of the heart. And you see that beautiful pipe that's run on top of the heart. It's a 3-4 millimeter pipe. And that's, for example, we call the widowmaker. That's the main artery that runs on top of the heart. Why do we call it the widowmaker? Because when a major heart attack happens and there is a blockage in the blood supply in the beginning of the pipe, what could happen, all this area of the muscle of the heart is not going to get blood. Can you see my cursor on the screen? Perfect. So this is a test called cardiac CTA. We have tests called stress tests. We have plenty of tests that we can diagnose and talk about pipe disease. But look at this area here. That's what I wanted to show you to explain why we talk about cholesterol, why we talk about diabetes, why we talk about hypertension, because of this thing here. What is this where you have the two areas here? It's called the atherosclerotic plaque. And you notice it is a little bit of a dark core. Here, if we take a sample of it, we're taking a look here, and you see here's the blood supply. We gave contrast, that's why it's bright, but that's around it, that's all plaque building inside the pipe. We all have pipes at home, and sometimes we see this white stuff building on the plaque, some plaquing building on the pipe. It doesn't mean there is bad blockages. You open the water flows, but it means it is beginning to build up that plaque. And if that plaque gets worse, 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 that's where people start feeling what we call angina. Every time they ask the heart to do more, there is not enough blood supply to supply the heart, and patients start getting tightness in the chest. Another disease is called a heart attack, which is the same exact thing, but all of a sudden that plaque popping and rupturing. And when it does that, the body thinks it's a wound, and it tries to clot it and becomes 100% clot. And all of a sudden, that blood supply here stops, and the rest of the heart is unable. And that's where we call it the widowmaker, because the heart cannot supply. It can survive for 2, 3, 4, 5 minutes, 10 minutes without blood coming in, but eventually it starts dying, and that's what we call a heart attack. That's when we tell patients, if you are sitting down doing nothing, all of a sudden tightness on the chest, jaw tightness, left arm tightness, you gotta call 911. That's not heartburn anymore, that's a heartburn. So the same exact principle when we talk about the brain. So these similar pipes go to the brain, and they start as large pipes like highways, and they get smaller, smaller, and they go like exits in the brain, right, to get the blood supply there. So if these pipes block for the same exact reason, like here, we get what we call a brain attack instead of a heart attack, which we call a stroke. The same thing for the legs, and it's very similar situation. So the focus today, to show you, can we prevent this from happening? Do we have the ability to do this, right? Because mostly you will find the most powerful risk factor of this is having genetic disposition. You got the gene from your parents. You can't choose your parents. You got the seed there. Number two, getting older. and we all would love to get older, right? We want to get older. So those two I can't change, but we can change some other stuff. Hopefully in the future we're going to be able to change that seed. We can on some certain conditions, but hopefully in the future we're still trying to understand the genetic factors that causes heart attacks. It's not one gene, it's multiple, and we can actually start testing for them right now. Not yet commercial though. So the question is, what are the risk factors that we all talk about stopping smoking, we all talk about diabetes, but does that really translate into benefit? And actually it does. So here I'm showing you a slide that shows the mortality. Mortality means the death from heart attacks, from strokes, has come down significantly by almost up to 40% in the more recent years. And uh, even like what we call STEMI, which is a fatal heart attack, has come down significantly. We have several data, even up to 2017, showing this. And the question is, how were we able to do this? And turns out it's not one thing, it's two things, right? We have a lot of new therapies that we can do, right? And we have a lot of risk factors that we understand these days and what we can manage. So when we talk about what's coming, remember, it really works. So let's pay attention for the next few slides. So despite all of this, what we have done, we are still fighting a huge battle. Cardiovascular disease is still going to be the number one cause for death, for morbidity, for mortality in the country, right? So every half an hour, we still have an acute heart attack. Every minute and a half, we have somebody dying out of a heart attack. This could be our loved ones. So that's why I'm really excited to do this, because we have weapons to fight back. We don't give up, right? The question is, first of all, we got to know our enemy. What causes that plaque that you saw in these pipes, right? That's going to be very important, because you got to go back to the root cause, right, to do an analysis and be able to tell. So we have this study that was called the Interheart study, which was amazing. It took 52 countries, so multiple ethnicities, multiple social backgrounds, multiple ways of living, right? Took 15,000 cases of acute myocardial infarction and said, let's find out the risk factors. Is it different for each country? It turns out actually the risk factors are the same in every geographic region, ethnicity, or gender groups. And we were able to identify them. So see this line here? Stuff on this side are turned out to be causing heart attacks, associating with heart attacks and strokes. On the right side, and here it was more heart attacks, and they did another study called the Interstroke trial, which was the exact same thing, very similar. So it's the same disease we're talking about. And you see here, smoking. Yes. Okay, so smoking, diabetes, hypertension, abdominal obesity, even depression and anxiety, uh, that all caused a significant increase in heart attacks, including dyslipidemia. Dyslipidemia meaning cholesterol problem. So we identified the risk factors for heart attacks. Now, what can protect you from heart attacks? You can see here, fruits and vegetables. Eating fruits and vegetables is a protective factor. Exercise. In the old days, that's an old study, 2004. So alcohol was thought to be beneficial. Now in the newer data we have, we are not as certain as it is. So we stopped recommending go drink alcohol to prevent yourself from heart attack, because now we have much more data that's more concrete. So, but overall, the strongest factors here you can notice is the cholesterol, and that's why we're going to spend some time talking about cholesterol. Number two, smoking and diabetes. Okay, so those are the important risk factors. And turns out many people don't have one risk factors. When you have two, when you have three, when you have four, when you have all the risk factors, the risk was significantly higher. So when you have all the risk factors, the risk is almost 500 times more. So that's what's important. The interstroke study was very similar. The only difference was hypertension was very important in this in stroke, which is, you probably can understand, if the pressure is too high hitting the brain, that's what starts with a ischemic stroke or bleeding in the brain, which is called another stroke. And here you see, when we talk about cigarette smoking, the number of cigarettes is very important. So the more smoking that you do, for example, more than we call smoking if you smoke a cigarette a day. So that's called smoking. But if you do 20, that's definitely worse. So when you cut back, don't say my cardiologist is telling me to smoke 10 because it's better than 20. No, even one is bad, but 10 is less worse than 20. All right. So we know now what causes heart attacks, right? In addition to genes, in addition to blood pressure, to aging, the other risk factors we just talked about. So the question, if we look at the adults in the U.S., 35% of us suffer from obesity. Almost 35% of us have hypertension. 40% of us are pre-diabetic. We still have a lot of smoking, right? Sedentary lifestyle. So we are dealing with epidemic of these risk factors, right? And that explains it all, right? Remember those numbers we talked, the heart attack, we are trying to control it, but in the last 10 years that control has plateaued. We're not getting lower because we still have plenty of risk factors, and actually those risk factors are going higher. Even in kids, look at kids. I got you this slide to show you, even kids, they don't have ideal health factors anymore. We have plenty of kids who are having high cholesterol, high blood pressure, couch potatoes, right? And a lot of sitting and playing video games, not moving around, eating all the junky food and high fructose stuff. So it is a problem. It is a disaster. If our kids are like this, what are they gonna grow to do? They're going to have much more problems, suffer from obesity. They're going to have more problems with hypertension. It's going to become harder to control diabetes. So should we give up and sit around, or should we fight back? Let's do it. So when we talk, a lot of people talk about stents in the heart. Let's do medications. Let's do stuff, or let's control smoking. Or actually, it starts way earlier. It starts with what we call primordial prevention. Primordial prevention is something that you apply to the society. It's something that you apply to your family, to your friends, and the whole society, which is very important, right? It's exactly when they increase the price of cigarettes, putting taxes on cigarettes, preventing selling cigarettes to minors. When we talk about, I'll give you an example here. In our doctor's lounge, they've replaced having chips and snacks and stuff with healthy options. It's easy. Put a fridge there, put some healthy options. It's exactly when you talk, it's really expensive and time consuming to consume vegetables and fruits. It's about trying to make these options more affordable. In the US, we have food deserts, right? Where people cannot really have access to healthy food, and it has shown it is correlated much more when people are eating McDonald's every day. I don't want to say brand names, but all I'm saying about when you eat junk food all day or every week, several times a week, because it is the thing you can afford to do, and it is the thing you can afford to do with your lifestyle, right? It's a problem when you are sitting behind a desk every day for doing your remote job, or you are saying, again, like I do radio cardiology. I'm sitting behind a desk all day, averaging 2,000 steps in my job. That's a health risk. So now we have these treadmills in the same place, right? You're sitting and you're doing treadmills, or you're standing discs. So that's kind of where it starts working. Instead of having our kids play PlayStation, let them get into virtual reality and do some movement with it and get their heart rates up, and they can move around. And let them go play outside like old days. So lots of initiatives are being done, and you can look it up. Million Hearts, like everybody is talking about this, because remember, an ounce of prevention is worth much more than treatment. So we have campaigns for all these aspects, and they are working. And we can go to talk about specifics right now. So when we talk about specifics, right? Let's say I had a family history. My father died at age 60 with heart attacks. Well, that gives you a warning. Heart attack, as you noticed, doesn't happen all of a sudden. There's something brewing in the pipes of the heart for the last 30 years, 20 years. And we can, with our technologies these days, detect that. We can detect if you have plaque building up. We can detect blood work that shows, is the plaque controlled or is it growing? And it is very important. We can deal with this and we can specify exactly a therapeutic regimen for you. But the main important thing after you do the general thing is to work on what we call the simple seven. And here I'm going to spend some time. So I call them the simple seven because they are seven, but nothing of them are simple, to be honest. So, number one, and number two, and number three is basically stop smoking. Tobacco is the most problematic of all. And everybody eventually stops smoking. It just depends when. When they decide, when they get a kid, when they have a surgery and nobody is ready to put them to anesthesia because they are smokers, or when they see that mass on the lung CAT scan, or when they require oxygen, but eventually everybody stops smoking. We have a lot of ways to help you stop smoking. We have smoking cessation clinic. It is a behavioral therapy. It is a very difficult thing to do, especially many of my patients started smoking when they were 17 and 16-year old, and they are now 60-year old. They're like, how can I stop smoking? I'm like, everybody does, and you can. And the problem is, when you stop smoking, if your partner or somebody lives with you in the house, your daughter, or your parent smokes, many times people go back. If you're still hanging out around the same friends who smoke in a smoking lounge, you will go back to smoking. So it has to do a behavioral change too, right? And we have behavior and pharmacotherapy that we can use. Now, when you stop smoking, the lung function when we are born. I'm going to just step aside a little bit to talk about the lung. Usually, the lung function declines when we are born, when we die, like this. I don't know if you can see me also. Can you? Yes. So, but if you smoke, the lung function starts declining like that very sharply. The moment you stop smoking, it never gets back to normal, but it slows down again to the normal level. For stroke and for heart attack, actually the effect of smoking goes away after 2 to 5 years. So we still say you are a smoker even if you had stopped smoking 2 years ago. So if you don't want a stroke or a heart attack 5 years from now, you stop smoking today. You see what I mean? So that's why it's essential to start as soon as possible because it takes a while for the smoking effect to come down. So smoking cessation is number one. Then I talk usually to my patients about three things. Okay. And the three things on him. So what we call a diet, changing the diet. You know, they did this beautiful study, is called the Predimit trial, where they took a low fat diet, which is typically recommended by cardiologists, low fat diet, but they compared it to a different kind of diet. It's called the Mediterranean style diet, which was basically plant-based food, lean protein, mainly fish twice a week, extra virgin olive oil, some fibers. And within a year, they saw half of the event in the Mediterranean style diet compared to the low fat diet. Within 5 years, they had to stop the study. It was not ethical to feed people anything but Mediterranean diet anymore. So because of the improvement they saw and the risk of the plaque that we were talking about and the effects. So Mediterranean style dieting, that's the recommended diet from cardiac standpoint. Again, just cut down on all the easy carbs, the simple carbs, the pizza, the pasta, the potato, the bread, all the good stuff, right? Cut down on those because you eat those, they get absorbed right away. They are purified, they are refined carbs, all of the sun. So the more processing the food undergoes, like if you eat an apple, that's not a processed food. But if you eat an apple, if you drink an apple juice, that's a processed food. So that's worse than an apple. So the more processing the food goes, so if you just cook it, that's processing. But if you cook it and chew it and do stuff and then eat it, that it becomes more. The 100 calorie become more dangerous than the 100 calories that you got through the raw food. So that's what's important. Cutting down on the pork, on the fried stuff, right? A lot of people tell me, yeah, I eat chicken, but turns out to be fried chicken. Or it's like, or I eat vegetables, but turns out to be French fries. So no, that's included in the easy carbs, right? So physical. So that's number one, the diet. Now, number two is the physical activity. So we generally recommend, and that's American Heart Association, 150 minutes of moderate physical activity a week. So go out walking about 30 minutes a day, 5 days a week. Now, if somebody has had heart disease already, we increase that to 40 minutes. So what we're saying is get that body moving. And, even if you do have bad blockages, a lot of patients tell me, oh, I have bad blockages in the heart. I should have moved. And I'm like, no, it's the other way around. Now I'm talking with you under the guidance of your cardiologist, not doing it on your own. If you get chest pain every time you walk, we need to know about that. But what I'm saying is a lot of people who have heart disease, the more they walk, they get the heart moving. So the heart can get used to stress, you know, even if you have blockages. It's like when you have a blockage on the highway that gets you to KU I-35 and you're late for your appointment, you go. If you take that road every day, you know all the exits, you know all the shortcuts you can take. So the same thing, the heart, even if you have bad blockages, it can start building some new, smaller channels around the blockage and get the blood down to the heart. So that's why physical activity is very important. So, and physical activity here, I'm talking about moderate activity, moderate intensity, which means fast walking, getting that heart rate up. But also, walking itself, even walking, how many steps you average a day is very important. It turns out if you get less than 5,000 steps a day, you're talking about a risk factor for heart attacks and stroke. If you get 10,000 and more, that's much better. Not a lot of people can do 10,000 a day. So we say usually at least 5,000 a day, and uh, every 2,000 steps extra you do, you get actually much more benefit. So I'm gonna leave a quiz here. If somebody can answer me in the chat, is who do you think in the hospital does the most steps? You will be surprised. Yeah. So let's keep going. Weight loss. Weight loss is very important because we talked about the diet, but when you drink a cup of extra virgin olive oil a day, that will make you gain weight. So we're saying kind of you have to be balanced, right? The right diet, but at the same time, the right portions. So we use something in the in cardiology uh, to we use something in medicine in general to measure the weight. It's called the BMI, the body mass index, and it's your weight to your height. But clearly, that does not reflect really clearly the cardiac risk because sometimes you could be just muscle and your weight might be high compared to your height, but it's not risky. So actually, what we use, the most important one, is called the waist circumference. The waist circumference. And having a waist circumference above 40 inches, that's really a high risk for having heart attacks and strokes. Why? Because that's what we call abdominal obesity. Okay. The body, you remember when you eat, that's sugar. And sugar is energy. It's like when you if you have a grocery store and you order again you ordered 1,000 apples. Well, you can put 100 apples. What are you going to do with the 900? What you're going to do, you're going to have to store them some way somehow. And the body, that's what it does to the extra sugar, to the extra calories you have. It stores it in a fat cells. And a lot of people store it in the belly on the outside, but many times it's also stored in the inside. And that's what we call visceral adiposity. And that's actually the dangerous type. Why? Because it increases inflammation in the body. And in the body, inflammation is bad. So basically, when you have cholesterol and inflammation together, that's what builds a plaque. Okay. So weight loss is important. The old plain way of cutting down your food, the amount of calories, calorie count, working out are all helpful in losing weight. But turns out obesity, or if you want to use a politically correct term, excess energy syndrome, let's call it this instead of obesity. That's the new term for it. Excess energy syndrome is basically multifactorial. So a lot of people tell me I don't eat, but I'm still gaining weight. So what we're talking about here, it could be related to bacteria in the gut. It could be related to hormones. It could be related to medications you're on. So there are multifactorial causes for obesity. And nowadays in KU, we have something called the overweight clinic or the weight loss clinic. And what they do is they go through all these factors. Doctors actually specialized in weight loss, because it turns out it's way different than, okay, you have to eat less. You see what I mean? So that's why it's important. And nowadays we have new medications. You have all watched probably what's called Sims Park, and they talk about this, all the new medications, the GLP-1 agonists. You have seen all the ads on GLP-1 agonists. I'm not going to go there right now, but usually we say it is indicated when the BMI is 30 or above, or high circumference, and you have risk factors. And sometimes we talk about weight loss surgery. It's one of the few therapies that actually can avoid you having strokes and heart attacks. And whenever the BMI is 40 or above, so what we call morbid obesity, when somebody has morbid obesity, there's a lot of work that has to be done conservatively, like lifestyle changes and exercise and medical therapy. And if it doesn't work out, what we can do what we can do is adding the weight loss surgery. Okay, so we have all these programs at KU. We can always talk to you about it at one point. Now, these are the three most important things that I give it as a homework for the patient: is exercise, try to do the 30 minutes a day. Having a dog in one of the studies showed that it can save your life, not just by protecting you, but by you having to go outside and walk it. Right? The diet, weight loss. Now, on the other hand, what we do with you is try to treat three things. It's called the blood pressure, which is very common disease. If your systolic blood pressure, it's not hard. Like, again, you guys are all connected to the internet. You are listening to me through Zoom, so it's easy. You have Google. I don't hate Dr. Google. Actually, a lot of people hate it. I hate it to make decisions for you, but I think you should Google stuff. I think you should look stuff. I think you should take initiative of your health. So I totally agree. I'm here just as a coach to be able to guide you through all of this. Okay, so blood pressure is very important. You can get a blood pressure cuff anywhere. You can go to Walmart and get your blood pressure checked. Check your blood pressure at home. If it is 130 or above, that's high blood pressure. And guess what? We call hypertension the silent killer. Why do we call it the silent killer? Because it causes strokes and heart attacks, and people feel fine, but they never check their blood pressure. So it's very important. Get a blood pressure cuff at home. And if it's 130 or above, call your PCP, tell them I want to see you, and bring all the numbers, write them down, and show them the numbers, and they will treat you. 50% of adults have hypertension. Treatment of hypertension cuts down on stroke number one. Everybody want to avoid a stroke. That's how you avoid it. Figure out your enemy, the silent killer, hypertension. Okay. Number two, diabetes. Diabetes in the old days was really difficult to control. Insulin, you take insulin, it makes you gain weight means you need more insulin, you're more insulin resistant. These days we have new medications, we barely use insulin, we have new ways of monitoring blood sugar. You have an It's really much better control these days, and this has significantly changed the trajectory. Think of blood sugar basically building up in the pipes and causing blockages. The last thing I'm going to talk about is cholesterol. So you have seen that plaque. It's cholesterol, but it's not just cholesterol. We talk about the seven other things that makes that cholesterol go build as a plaque. So cholesterol is not a bad thing. A lot of people talk about cholesterol like it's a bad thing. No, cholesterol is a good thing. We need cholesterol. Even if you don't eat cholesterol, your body is making cholesterol all the time. Cholesterol is needed for the muscles, needed for the hormones. Your brain is making cholesterol all the time. But the problem, cholesterol doesn't move in the blood by itself. It's usually carried. It's like when you order something from Amazon or something. You order a watch. The watch doesn't come by itself. It comes in a box. So you took the watch. What's left over? So that's what we worry about, the leftover of cholesterol. It's called the bad leftovers, the trash. Or it has to be picked up and recycled, right? But if the body is not recycling that cholesterol and keep making more of these boxes, it becomes a problem and blocks the pipes. So that's where we talk about diet changes, we talk about exercise, but the most important thing is possibly medical therapy for cholesterol. So that's why we gauge the risk and we find out what's your risk. And many times you cannot control that just with lifestyle changes, because many times it's a genetic problem that your liver does not pick up the leftover of cholesterol and it just hang around in the blood vessels and the pipes, and it becomes a problem and blocks stuff. So this is really important. Get your cholesterol panel checked with the primary doctor. We have ways of trying to detect heart attacks at an early age, and we call it calcium scoring. We can do cardiac CTA, like the one you saw here in the first slide. So all I'm saying is, if you have if you shoveled some snow this year, if you watched the Chiefs and you grabbed your chest and you called 911, that means your heart has an issue. Call a cardiologist. Okay, so all I'm saying is recognize what heart symptoms are, seek care. Do not wait until you get a heart attack. If somebody in your family had a heart attack or a stroke, come in early. Just request your primary doctor to send you to the cardiovascular prevention clinic. And we have several doctors, several nurse practitioners, all provide hopefully wonderful care with you. And I'll think I'm gonna end here to see if there's any questions I need to answer. Sorry, I went
Oh,
beyond time.
Dr. Morad, I think you gave us such a great call to action, some really great tips for not only our hearts, but our heads. I've always said in my career, what's good for the heart is good for the head. And I think that you have proved that, showing us the great pictures and the information and everything. So thank you. There are a few comments in the chat that maybe we can take a few more minutes to address. We do want to know the answer to the quiz, Dr. Morad. Who walks the most at the hospital?
Yes, so it turns out transport.
Ah, of course. Okay.
30,000 to 35,000 steps a day. Incredible.
Wow.
Incredible.
That's what, like 15 miles maybe?
Yeah, it's incredible.
Wow,
They're
that's
going from
amazing.
area to an area. It's incredible.
Okay. Well, thanks to all those great transport folks for getting us to where we need to
Absolutely.
go.
Absolutely.
Yes.
So we have something I would put in a word for our local wellness center, most have their communities. Yes, please. Absolutely.
Yeah. Oh, looks like a question just came in, Dr. Murad, about sleep as a factor for a healthy heart. Can you address sleep?
Yes, it's absolutely important. I should have added this here. Actually, I had it on a different slide. Probably I didn't bring it in. Yes, so sleep apnea, that's very important. And actually, I still have one thing, mental health there. So we'll
Ah,
talk about both. So sleep apnea is very important, right? If you snore, you wouldn't be able to tell. Your partner might be able to tell. Your kids might be able to tell you, hey, you snore. I was like, no, 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 I sleep well. Well, sleep apnea is not that you don't sleep well. You actually sleep really good. You have no
mhm,
idea that you're not sleeping. It's just like somebody trying to kill you 10 times per night. You stop breathing and you have no idea what's happening. Your oxygen is dropping. And when the oxygen drops, that puts a lot of stress on the body and the blood pressure gets really high. And then it can become a problem for hypertension, for arrhythmias, for lots of problems there. It can push to heart failure. So if you snore, if you feel sometimes fatigue during the day, if you open your mouth and you look in the mirror and you see it's a large neck and a tight throat, that's probably you have sleep apnea. If you feel sleepy during the day, if you had sat down to watch the movie and then all of a sudden in the theater or something you went to take naps, that's probably you might have sleep apnea. Talk to your primary doctor about it. They can do a sleep test, and it's usually done in the house. In the old
mhm.
days, you go and have to sleep in a lab. These days, we still can do it for confirmation, but usually we do a sleep test at home. It's a simple one, and you will see if you have sleep apnea, especially moderate or severe, you get it treated. We have many ways of treating it. Don't always think you have a mask on your face. Sometimes you
Hmm.
have a small nasal cannula. Sometimes you have surgery. Sometimes you have a little device now. It's called the Inspired. We have plenty of other stuff that are in the market. So basically, talk to the sleep clinic. Mental health is very important because it's what we call bidirectional relationship. Meaning, if you get a heart attack or a stroke, that will result into depression and anxiety. And we have to recognize both. If you have depression and anxiety and stress, your adrenaline always high, your cortisone is always high, that increases the blood pressure, increases diabetes, and increases the risk for heart attacks. So it's very important to recognize it. If you feel depression and anxiety, stress, talk to your primary doctor about it. They can do behavioral therapy, cognitive behavioral therapy, medical therapy. Seeing a mental specialist will be very, very important. Now, We talked about the waist circumference. I think they're asking 40 inches. Yes, for men, and for women, 35 inches and above is increased.
Okay. All right. And then, Dr. Morad, could you answer the question about lifestyle modifications against amyloid plaque formation? We know that that's involved in
Yeah, I'm not sure in the
dementia.
amyloid plaque formation. I'll probably defer this question to a neurologist.
Okay. We
But
can
I'm
get that
assuming they
question.
can help, but I will defer
Yeah.
probably this to a neurologist.
We can give that question to Dr. Burns and Dr. Swerdlow and all the other great folks at the
Yes.
ADRC, and I will I'll make sure to have an answer for that. Okay. And then gosh, I know we are over time, but we have one more comment. I hope we've gotten everything. One more
Yeah, what
comment
term did
about
you use? Yeah, the
yes.
clinic we have is called the weight loss clinic that we have. Now, the term obesity is called excess energy syndrome when you go to the medical boards. It's just extra energy
Okay.
that's being stored. So,
Thank
uh,
you.
and absolutely, absolutely. And thank you very much. And yeah, well, I really appreciate the opportunity for the invitation. And yeah, if you have anybody in the family who has had a heart attack or stroke, please call your primary doctor. There are multiple. I love this. So there are multiple ways of trying to determine the risks earlier, and hopefully new things are coming to the market. We're gonna hopefully
Yes.
be able to tell by checking the blood who has risk factors for heart attacks and strokes. And this is going to be revolutionary because, again, we have something to do about it. Talk to the kids, encourage the kids to move around. Healthy stuff at home is very important to start at an early age. I was impressed when I took my kids to pediatrician and she was like, do you do 5,000 steps or more at home? I'm like, wow, I wish somebody told me that when I was a kid. All right. Thank you. Take care, guys.
My goodness, thank you, Dr. Murad. I hope you see all the great comments in the chat. I
Absolutely.
agree, especially thank you for your professionalism, your expertise, and your enthusiasm. I knew when I heard you on our last Zoom meeting that you would be a great presenter for this group. So I'm congratulating
Thank you
myself
very
on
much.
being correct. So thank you.
Appreciate it. Take care.
Yeah.
Thank you, everyone, for being here. Thank you for indulging a few extra minutes. I think this just means we have to ask Dr. Murad to join us again with more information. So he'll stay in the rotation. Next week, I saw the comment from someone who said something about non Kansas and non Missouri universities. So duly noted. But I do want you to know that next week's presenter is our colleagues from down I-70 at the Washington University Alzheimer's Disease Research Center. I've been meaning to get them on our webinar almost since I started, and finally, the right combination of events has happened. So we will have some folks from the Washington University NIGHT, that's KNIGHT, Alzheimer's Disease Research Center in St. Louis will be on our webinar next Thursday. And they are going to tell us what they do, which is probably almost as good as what we do. And yes, I know I said that on the recording. But we'll see. And they will also be specifically talking about a study that they have called ARCHES, get it, like Arches in St. Louis. And I'll let them tell you what ARCHES stands for. But it's going to be great, as I think all of our webinars are. Thank you so much for being with us, Dr. Morad. Thank you again. I see someone raise your hand. I'm willing to stay. Yes.
Oh my gosh, can you hear me?
Yes.
Oh my gosh, I just got in here late. I'm so sorry. I haven't been here for a long time, so I just wanted to say hey to everybody, and
Wonderful.
I'm glad to be back in the class. Thank you.
Glad to have you. And if
Uh,
anybody came in late, this is recorded, so it'll be available later on this evening, probably. Yes,
great,
Mr. Holtis.
it's a great one.
Good, good.
Kelly,
Okay, Mr.
I'm
Holtis,
the
I
one
see
that
you have
put
your
in
hand.
about the community wellness centers. And
Yes.
that has been an excellent place if that people will come down. In fact, I'm doing this today. I'm experimenting on our big screen TV in our conference room down
I
here,
love it.
and that possibly some other people might set in and visit in on it. But there's a real fellowship with getting together to exercise, just like they would drink coffee in the other days and so forth. And then they can exercise, they can have little competitions, they can do lots of stuff. And instead of making it be a
Excellent.
burden, they can make it be a good time to come down. And we're if you're 90 like I am, it's free. But
I love it.
if you're a senior citizen, it's $30 a month. So if you're in driving distance to Smith County, Kansas, come and see us. All right.
Hey, I think, yes, what a great invitation. Thank you.
You
All
bet.
right, everybody. I'm gonna finish this up for today. I hope you have a great week. We'll see you next week, June 5th. And stay tuned. We'll have the link for this recording in the next issue of My Alliance. Have a great one, everyone. Bye-bye.